Hi, my name is David Yoskowitz. I'm a cancer survivor. I graduated from Columbia University Engineering School, and my strength is engineering and design.
This is my factory where we manufacture commercial heating and air conditioning components. I met my wife 11 and a half years ago. I have a 7-year-old son and a 5-year-old daughter. It's why I go to work, it's why I get up in the morning, and I love the two of them. My mom passed away from cancer in April of 2013. And prior to her passing away, after she was diagnosed, I told her I was going to run a marathon for her. Happened to be in Hawaii because she had never been to Hawaii, and she was going to come watch me run. I ran the marathon, I completed it. It was probably the most difficult thing I've ever done in my life. And I would not have finished it had I not promised my mom that I was going to run it for her. A month after I ran the marathon, I felt a bump on my neck. I thought I had just gone to the gym and I worked out, and I thought maybe it was like an unusual pulled muscle. I showed my wife, she said, "You better have it checked out." And I think I went to the doctor the next day, felt it, and he sent me for a fine needle aspiration, which showed Hodgkin's lymphoma.
An out-of-body experience when you hear that your husband has such a horrible illness, and we had 2 little kids. It was a lot to handle.
I was, of course, scared, I guess like a cornered animal, and I was going to fight and do whatever it took to try to beat the disease. The most uncomfortable part of the chemo treatment in the infusion center was trying to get myself to keep the ice chips or the ice pop in my mouth and cool the entire inside of my mouth, because I read and I was told you're susceptible to mouth sores or mucositis when you're being given certain types of chemo drugs. That can cause infections, which means you would have to stop your treatment, which reduces your chance of being able to beat the disease.
I wanted to help him, if there was some way to give him relief so he would be able to, eat normally and swallow normally and sleep normally.
When I was going through my treatment, I thought of nothing other than completing the treatment. It was a year later, I woke up in the middle of the night and God gave me this great idea to have an ice pack that goes inside the mouth to cool the mouth. Evolution of the mouthpiece. This is where it started, and over a period of approximately 1 year, this is where it's finished. And then years later, now having a finished product, I know that this product would have helped me from a comfort standpoint and an effectiveness standpoint when I went through my treatment. I'm sure it will do the same for many cancer patients.